Dr. Dale, I am going to let you take over and talk about the history of your book and what your book talks about.
The reasons for the book are that throughout my life, I've seen the power of the written word. There's a very famous saying, probably a Shakespearean comment or whatever, that the pen, the pen is mightier than the sword. And I'm very aware that opportunity like this, it's a wonderful privilege to share something. The thoughts and ideas, of course, nowadays are all captured by video or whatever. But the written word is still extremely powerful. As I began to experience more of what healthcare was about, I guess the ideas for the book have been bubbling around inside for a number of years. But what actually prompted me to decide, no, I've just got to create the time and space to do this, was when I read Professor Marty McCary's book, The Price We Pay. Now, he does a brilliant job of peeling the layers off the onion. And this is an onion that is going rotten. There's that sense as you read through his book, oh my goodness, I knew things were bad, but I hadn't realized they were this bad. And of course, for myself being very, very involved in this world for 25 years at this point, having started a company that has negotiated hundreds of millions or billions of dollars of medical bills on behalf of consumers, then starting Sedera and really helping create a alternative model so that we don't live with this misconception that somehow insurance is the only way to deal with large bills. It's one way. It's a good way in some circumstances, but it's certainly not the only way. With all of this sort of ideas bubbling around inside, what I said to myself, wow, Professor McCary, you've done a brilliant job outlining the problem. But we've been hearing about the problem for years. We've got to find what the answers are. And I've been very privileged within Sedera getting to meet all sorts of wonderful people. And of course, the book is really a book of stories. Yes, many of the stories are personal. They're my own experience. But also, I tell the stories particularly of a variety of other physicians and what they're doing. Because I think answers for healthcare are already emerging under our noses. It isn't just that we have, as it were, an insurmountable problem. No, we don't. The power of the free market is actually already showing people the way forward, and that's what the book is about.